Hey everyone, Bridget here at the AAFE Training Center. We are doing some neurotoxin on my patient. We are treating her upper face today, so her frontalis, glabella, and we're doing a little bit of a brow lift. So I dosed her appropriately based on the set of her eyes. She does have more of like shallow set eyes and she does have some hooding, so I do go pretty conservative on her forehead and I go pretty aggressive in her brow lift. So I'm just making sure to treat all the way to those lateral borders and then kind of just filling in the gaps from there. So I'm making sure you can see where that movement drops off, and I'm going to do an injection point right there. If I don't treat all the way out, it will give her what's called a spocked brow, which is basically where the tails of the brow are kind of lifted, more exaggerated looking. Some patients like that. Some of the patients, especially with hooded eyes like her, like that because they use their forehead so much to lift those brows that when you treat it with neurotoxin, a lot of times it will make them feel heavy or that they can't open their eyes well. We're now moving down to the glabella, which consists of the procerus and the two corrugators. So I'm treating the medial head and the corrugator tails. So I'm seeing where that movement drops off and making sure to not treat further out than that. The muscle that runs underneath of the corrugators is the frontalis. So if you treat outside of the corrugator, you're going to definitely drop the patient's brow. So just making sure to have them really exaggerate that angry face before you treat those tails. So you can kind of see her movement is a little bit further out. So I'm going to go right in front of that movement. And I always like to hold the orbital rim for a few seconds just to prevent any leakage of the product. And then for a brow lift, you're going to go really superficially. It's just treating the orbicularis oculi, so the same muscle you would treat for crow's feet, but you're treating it up further into the brow. I use a tight dilution for this, and I usually do, a few units either in the arch or the tails or both, depending if they are wanting more of a curved brow versus more of a straight brow. So I always ask the patient that question as well. And then to find this, I either have them smile really big or have them squint really tight together. I hope this helps.